Bad breath. It's not just embarrassing, but your breath may be warning you of hidden health issues that you don't even know about. This video is for educational and informational purposes only. It is not intended to diagnose, treat, or replace professional medical advice. Bad breath can have many causes, some minor and some more serious. If you are experiencing persistent or unusual symptoms, please consult a qualified healthcare provider or dentist. Always seek the guidance of a licensed medical professional regarding any questions you may have about your health. Bad breath, medically called halitosis, affects millions of people. Most of us have experienced it, and many suffer from it chronically. It might feel embarrassing or make you feel isolated socially, but did you know that bad breath could be more than just an inconvenience? It can sometimes be a symptom of something more serious going on inside your body. Before we get started, please take a moment to like and subscribe to my channel. Doing these two things will help us spread our mission of becoming the #1 trusted source for medical questions online. Now back to bad breath. What exactly is it, and why does it happen? Bad breath occurs when there's a buildup of odor-causing bacteria in your mouth. This can happen for various reasons, from not brushing your teeth enough to having certain foods. But did you know that it can also be a signal of some underlying health conditions? One of the most common causes of bad breath is poor oral hygiene. When you don't brush and floss regularly, food particles can build up in your mouth, providing a feast for bacteria. The result? Unpleasant breath. This is usually pretty easy to fix with better oral hygiene habits. But here's where things get interesting. Certain foods like garlic or onions can also cause bad breath. These foods have sulfur compounds, which are notorious for leaving your breath stinking long after you've finished eating. Now, this is normally temporary and should go away after a while. But if you notice that the smell lingers for days, it could be a warning sign of an underlying health issue. Now, what health problems can cause bad breath? One of the most common culprits is gum disease. This happens when bacteria infect the gums, causing inflammation and redness. If left untreated, it can lead to tooth loss. People with gum disease often complain of chronic bad breath because the bacteria involved can cause volatile sulfur compounds to enter the bloodstream and show up on your breath. The good news is that gum disease is preventable and treatable with good oral hygiene and regular dental checkups. Another condition linked to bad breath is diabetes. People with poorly controlled diabetes often have high blood sugar levels. This creates a perfect environment for bacteria to thrive, leading to bad breath. And yes, diabetes can absolutely cause bad breath. It's all because of that high blood sugar I mentioned before. So if you have diabetes and you're battling bad breath, it might be time to work with your healthcare provider to get that blood sugar under control. The better you manage your diabetes, the less hospitable your mouth becomes to those stinky bacteria. But diabetes isn't the only metabolic disorder that can cause bad breath. People with liver disorders like cirrhosis also tend to suffer from this condition. Cirrhosis leads to a buildup of toxins in the blood, which can then end up in your mouth and on your breath. So if you struggle with both bad breath and liver problems, it's essential to keep working closely with your healthcare team to tackle both issues. Now let's talk about digestive problems. Conditions like gastritis or gastroesophageal reflux disease, GERD, can lead to stomach acid backing up into your esophagus. This can cause a sour or acidic taste in your mouth, leading to bad breath. In fact, heartburn is one of the main causes of persistent bad breath. That's because the stomach acid contains hydrochloric acid, which has a pH level of around 1 to 2. The lower the pH, the stronger the acid. And when that comes up into your esophagus, it leaves a real bad taste in your mouth. Acid reflux happens when the lower esophageal sphincter, or les, doesn't close properly. The les acts as a barrier between your esophagus and your stomach, keeping stomach acid where it belongs. But when it relaxes at the wrong time, that acid can flow back up into your esophagus, bringing along unpleasant symptoms like a burning sensation in your chest, also called heartburn or acid indigestion. And yes, it can lead to bad breath too. How do you know when bad breath becomes a serious problem? If you've tried everything from brushing your teeth and using tongue scrapers to changing your diet and the problem still persists, it's time to see your doctor. Bad breath that won't go away could be a red flag indicating an underlying medical condition needs attention. When you visit your doctor, they'll ask you about your symptoms and perform a physical exam. They may also request tests to get a better understanding of your overall health. For example, a simple blood test can reveal whether diabetes might be playing a role. There are also specific red flags that indicate when you should definitely seek medical attention. If you notice blood in your saliva or on your toothbrush, it could be a sign of something serious like gum disease or even oral cancer. Likewise, if you experience sudden unexplained weight loss alongside bad breath, it's essential to consult your doctor. This combination could point towards a tumor or another underlying condition. While bad breath can be concerning, it's important to remember that it's often a treatable problem. By working closely with your healthcare team, you can identify the underlying causes and find effective solutions. What can you do to prevent bad breath? Well, let's start with the basics. Brush your teeth twice a day for 2 minutes each time, and don't forget to floss daily. These simple habits can go a long way in controlling bad breath. Now let's talk about your diet. Cutting back on sugary drinks and processed foods can help reduce the amount of food stuck in between your teeth, making it harder for bacteria to grow. And here's an added bonus. A well-balanced diet rich in fruits, vegetables, and whole grains can promote better overall health, giving you fresh breath and a healthy body. Staying hydrated is also key to preventing bad breath. Drinking water helps stimulate saliva production, which can wash away food particles and neutralize acids in your mouth. But don't stop there. Consider using a tongue scraper to remove bacteria from the surface of your tongue. You can buy them online or at most drugstores. Oh, and don't overlook the power of mouthwash. An antimicrobial mouthwash can help kill odor-causing bacteria and leave your breath feeling fresh and clean. Just remember to use it as directed on the packaging. If you're a smoker, quitting is crucial for fresher breath. Tobacco smoke not only causes bad breath, but it can also lead to gum disease and oral cancer. Your lungs and heart will thank you too. Chewing sugar-free gum after a meal can also help combat bad breath. The chewing motion stimulates saliva production and helps remove food particles from your mouth. Plus, some studies suggest that chewing gum after a meal can actually improve digestion. Look for gums that contain xylitol, a sugar alcohol that has been shown to reduce the growth of odor-causing bacteria in the mouth. So if you're looking for a quick and easy way to freshen your breath, reach for that sugar-free gum. In conclusion, while bad breath can be a frustrating and embarrassing problem, it's essential to remember that it can be a warning sign of underlying health issues. By understanding the common causes and knowing when to seek medical advice, you can take proactive steps to ensure your bad breath doesn't become a serious health concern. And here's a friendly reminder. I'm a doctor, and remember, you're just a few bad breath moments away from great health. Thank you so much for watching. Please like and subscribe so I can continue to bring you videos that help answer your medical questions and improve your health. If you enjoyed this video, check out this one next.